I'm Matt Willis, Public Health Officer from Marin County with a COVID-19 update for January 5th. I'm going to start with a scenario that I think will help orient us to the next chapter of this pandemic. If you were invited to attend an indoor gathering with 100 other people, and you were informed that some present were infectious with Omicron, but you didn't know who they would be, would you still choose to attend that event? It's not meant to be a simple question, and I think people will have different answers, but essentially this distills our current dilemma. We estimate that in Marin, currently, about 1 in 30 people are infected. I'm going to explain how we know that and what it might mean for us. Over the past 3 days, we've gained a better view on the true prevalence of COVID-19 in our community than we've ever had before because of a very successful testing drive. In order to return to school safely after the holidays, we distributed home antigen tests to all Marin County students and public and private and parochial schools, as well as staff. About 48,000 people total received kits, 40,000 students, and 8,000 staff. As of today, 31,000 test results are back, with about 900 positive results. This was an important way to make sure those 900 individuals who were infected didn't enter schools, so we're starting off on the right foot. This data suggests approximately 1 in 30 residents is infected currently, which means about 8,000 infections countywide. That helps explain why we're seeing a bump in hospitalizations, which has been a primary focus for us. We're up to 13 today in the hospital and 3 in the ICU, even though, by and large, the illness is mild, especially for vaccinated and boosted people. We're seeing signs throughout our community of the stress of high infection rates. Over 100 healthcare workers are in isolation for COVID-19 infection across all Marin hospitals. Pharmacies and skilled nursing facilities are short-staffed, and law enforcement staff are stretched thin. So we need to take steps to blunt the spike in cases from Omicron over the next 2 weeks, organized around 2 primary goals. One is to keep critical sectors functioning, like schools, healthcare workers, law enforcement, and the other is to slow the increase of patients coming into the hospital with COVID-19 disease. We made the decision to recommend schools not allow spectators at indoor sporting events for the time being. Obviously, this is not something that is done lightly, but here's the logic. With a prevalence of 3%, that means any game where 300 people may be present, between 5 and 10 participants will be actively infectious and spreading the virus over the course of that gathering. Masking and vaccination reduce risk, but don't eliminate it. And we know Omicron is breaking through these barriers, which is why we're seeing hundreds of cases a day. So the question isn't whether or not people would be infected. We know they would be. The question is a deeper one, which is what is our level of tolerance for these new infections, and where do we draw the line? This is part of the shift in our mental model, in our relationship with this virus, that we will carry forward as this becomes endemic. For those who are fully vaccinated and boosted, the risk of severe illness is low. And people may decide they value the experience enough to justify that risk, as long as their eyes are wide open to that risk. But for now, from a public health standpoint, we're in a dynamic phase with several important unknowns. We will be learning a lot over the next 2 weeks in terms of the stability of our institutions, our schools, and hospitals as Omicron surges. Our commitment from public health is to monitor closely and continue to apply the principles we've applied throughout of having the least restrictive policies possible for a balanced public health response. Thank you for doing your part.